Hi dear doctors, welcome to the class of Kidscovery. Myself Dr. Parv, and we are discussing pediatrics. Let's understand about the topic of behavioral disorders. So this is just an introductory video for behavioral disorders. There are different behavioral disorders which are seen in the tiny toddlers. So the mnemonic is to remember is calm, stand. Okay, calm, stand is the mnemonic. So what is C? C for conduct and oppositional disorder. So the conduct disorders and the oppositional defiant disorder. So actually this conduct disorder and oppositional defiant disorder is something which is of a domain of psychiatry. So this time I'm not going to teach, I'm going to ask you this question, because of course in psychiatry you must have read this. Tell me in which the child will only verbally abuse the parent. In which the child will only verbally abuse. Coming on to A for attention and impulsive disorders, ADHD, nowadays very common, attention deficit. In fact, I should say, many of the adults and not even the youngsters, adults 50 years, 60 years, they are not able to concentrate in their work. Why? Because this is something which is distracting, right? So attention deficit is also a behavioral disorders predominantly seen in the kids, hyperkinetic disorder. Then learning disorders like dyslexia, dysgraphia and speech delay. Then you have got so dyslexia is the disease, dysgraphia, very commonly seen in the speech therapy centers and everything. So mood disorders like depression and bipolar disease is itself a behavioral disease in like a 10-year, 12-year-old child is coming to the OPD with the symptoms of bipolar disease, with the symptoms of depression. A very pathetic situation, but yes, it is what it is. Sleep disorders like sleep awakening, insomnia, night terrors. Yes, diseases like insomnia, difficulty to sleep, is occurring in children also. Why? Because this is the device which is capable, very much capable to disturb your melatonin sleep-wake cycle, and of course, insomnia is going to come. Tic disorder, Tourette syndrome, transient tics are seen. Anxiety, yes, separation anxiety, social anxiety, these are physiological phenomena, but then considered under the behavioral changes. Okay. Next is neurodevelopmental disorders, autism spectrum disorder. Now, what is autistic behavior and what is autism? These are different things. Please ask your faculty of psychiatry to teach this. Okay. And in the end, you have got disorder of elimination of feeding, enuresis, of course, the nighttime urination once the control of urination has been established. Encopresis, again the defecation once the control has established. Still, the child is defecating in the clothes itself. Why? Because the child is having history of chronic constipation. Pica, anorexia. Okay, so pica, eating some obnoxious, not obnoxious but abnormal substances like chalk, like soil. Okay, anorexia. In fact, there are some more behavioral disorders also, like the breath holding spells. Okay, and I just will wait in the comment section so that you can add on into this list. So thank you so much for watching this. Okay, and we will see you in the next class. Thank you.